Hey guys, welcome back to my channel, The ENT Resident. Today I'll be discussing about the different signs that you see in epiglottitis and croup. So there are three signs over here. In croup, we usually see the steeple sign, and in epiglottitis, we see the tripod sign and the thumb sign. It can get very confusing between these signs. Sometimes we end up confusing which sign is seen in where, exactly which condition. It can be very confusing. I'll discuss each one of them. And under each sign, I'll tell you about what type of sign is this, describe the sign, what condition we see it in, and why is it called so. And maybe if there are a few MCQ questions related to this, I'll talk about that as well. You can also now purchase my notes. I have added links in the description. Okay, so let's get started. So our first sign is the steeple sign. Now, what kind of a sign is this? As we can see over here, this is a radiological sign that we see in an X-ray of the neck, specifically in the antero-posterior view or the AP view. So this is the first thing. Now let's try to understand what is the sign. Steeple sign is basically where we are seeing, if you look at the image and the arrow over here, the arrow is pointed towards the sign over here, we can see that there is a narrowing of the subglottic airway on this X-ray neck antero-posterior view. This appearance is known as the steeple sign. And this sign is typically seen in a disease which is known as croup, also known as acute laryngotracheobronchitis. This is the typical X-ray feature that you will be seeing. Why does this happen? What happens in croup is there is inflammation and edema which happens in the subglottis region. Now we know that subglottis is actually the narrowest part of the pediatric airway. When there is inflammation and edema involving this region, it leads to the area becoming very narrowed. So when we are looking at the anteroposterior view in an X-ray of the neck, we are seeing the upper tracheal column, air column, is slowly becoming tapered and narrow. And that gives rise to this sign which is known as the steeple sign. Why is it called steeple sign? Because this narrowed shadow that we are seeing over here, this resembles a church steeple, as you can see in the image over here. It's very similar, and that's the reason why this is known as the steeple sign. So important points to note here is, what is the site of narrowing? The site of narrowing is subglottis. What is the most common organism involved in this case? This is the parainfluenza virus. And what is the typical presentation that we see in case of croup? The typical presentation we see here is a barking cough and an inspiratory stridor. This is the typical presentation of a patient of croup. So this is about the steeple sign that we see in cases of croup, which is also known as acute laryngotracheobronchitis, where we are seeing a narrowing of the subglottic region. And very important to remember is subglottis is the narrowest part of the pediatric airway. Now next we move on to our second sign, which is thumb sign. Now this is exactly what usually people get confused with, students get confused, that which sign is seen in which disease. So let's talk about the thumb sign now. Now thumb sign is also a radiological sign which you are seeing on a X-ray of the neck, but in this case you are seeing it in a lateral view. Now what is this sign? First, let's look at the first image over here, which is that of a normal epiglottis. If we see the first one, this pointed area is the epiglottis. It looks like a leaf-shaped structure over here. But if we look at the epiglottis on the right image, which is that in case of epiglottitis, we can see it kind of looks like very swollen and it looks like a thumb. Like the thumb part, you can see that this portion looks like the thumb. That is the sign that we are seeing here. So essentially, thumb sign is an enlarged swollen epiglottis which is seen like a thumb-shaped soft tissue shadow on a lateral neck radiograph. This is typically seen in acute epiglottitis. Why do we see this? Now, in acute epiglottitis, what happens is there is severe inflammation and edema of the epiglottis and the array epiglottic folds. That leads to the epiglottis becoming very thickened and taking up this rounded shape. And because it looks like a thumb, therefore it is known as the thumb sign. So now you know what is the difference between steeple sign and the thumb sign, right? So now let's talk about a few MCQ questions related to epiglottitis. Now we know that in croup, I said the most common organism is parainfluenza. Here the causative organism is Haemophilus influenzae type B. And the most dangerous complication of acute epiglottitis is a sudden airway obstruction. Therefore, we need to remember something very important when we are clinically examining such cases. If we suspect that the patient may have epiglottitis, you should not attempt to do throat examination aggressively, because that can end up precipitating a worse sudden airway obstruction in the patient. That's something you need to be aware of. Now, this brings me to the last sign, which is another sign that we see right in acute epiglottitis, and this is the tripod sign. Now, let's talk about tripod sign. Now, as you can see, this is a clinical sign that you see when you are examining the posture of the patient. And this is a typical sign where the child will have a characteristic sitting posture where the child leans forward and supports themselves with their hands, and they extend the neck so as to improve their airway obstruction. And this is a typical posture that we see in case of acute epiglottitis. Now, what is the reason this is happening? As I mentioned, in acute epiglottitis, the epiglottis is inflamed and edematous, and this leads to a critical airway narrowing in the patient. Now, so as to maximize the airflow inside, what the child ends up doing is they take up this posture where they lean forward and they keep their mouth open with their tongue protruded out. Their neck becomes hyperextended. They thrust forward their chin and they place the hands either on the knees or on the bed for support. This typical sign that this whole posture is taking is known as the tripod sign. Why are they taking this position? This positioning is going to help reduce the airway obstruction that they are facing, and this will improve the ventilation. How is this happening? When you take this posture, the swollen epiglottis gets pulled anteriorly, and therefore it ends up widening up the supraglottic airway. That's how the patient is trying to relieve the airway obstruction that they are facing. Now, why is it called a tripod sign? If you look at the second image over here, this is what a tripod looks like. So you can see this posture that the baby has taken over here with their two hands on the body, it kind of looks like the shape of the tripod over here. Therefore, this is known as tripod sign. Now, what is a classic triad of symptoms that we see in a case of acute epiglottitis? We'll see that the patient will have drooling, then they will have dysphagia, and the third is they will have respiratory distress. And as we mentioned, the common organism over here is the Haemophilus influenzae type B. So, a very common MCQ trap question that you need to know if you want to differentiate between croup and epiglottitis is if the question mentions that there is a hyperextended neck and drooling, in that case we think of epiglottitis. But if the patient has barking cough, inspiratory stridor, but there is no drooling, in that case we think of croup. So that's all about the different signs that we see in epiglottitis and croup, and I hope that I have been able to explain the difference between the two signs and why they happen. So now you should not have any confusion at all as to which sign is seen in which, now that you know the mechanism behind it. That's all for today. I'll see you in my next class. Thank you.